Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 5 NCLEX questions. Without delay, let's get started.
The nurse has calculated a low PaO2/FiO2 ratio less than 150 for a client with acute respiratory distress syndrome. The nurse should place the client in which position to improve oxygenation, ventilation distribution, and drainage of secretions? 1. Supine. 2. Semifowlers. 3. Lateral side. 4. Prone. The correct answer is 4. Prone positioning is used to improve oxygenation in clients with ARDS who are receiving mechanical ventilation. Which of the following nursing interventions would promote effective airway clearance in a client with acute respiratory distress? 1. Administering oxygen every 2 hours. 2. Turning the client every 4 hours. 3. Administering sedatives to promote rest. 4. Suctioning if cough is ineffective. The correct answer is 4. The nurse should suction the client if the client is not able to cough up secretions and clear the airway. Which of the following individuals has the highest priority for receiving seasonal influenza vaccination? 1. A 60-year-old man with a hiatal hernia. 2. A 36-year-old woman with 3 children. 3. A 50-year-old woman caring for a spouse with cancer. 4. A 60-year-old woman with osteoarthritis. The correct answer is 3. Individuals who are household members or home care providers for high-risk individuals are high-priority targeted groups for immunization against influenza to prevent transmission to those who have a decreased capacity to deal with the disease. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanursguy.com. Back to the questions. When developing a plan of care for an infant with a cleft lip before corrective surgery is performed, which of the following should be a priority? 1. Maintaining skin integrity in the oral cavity. 2. Using techniques to minimize crying. 3. Altering the usual method of feeding. 4. Preventing the infant from putting fingers in the mouth. The correct answer is 3. Before corrective surgery for a cleft lip, the infant needs to consume formula or breast milk. Methods for feeding may need to be adjusted to fit the infant's needs. Because the infant with a cleft lip experiences a decreased ability to suck, which interferes with the infant's ability to compress the nipple. The nurse is administering gastrostomy feedings to an infant after surgery to correct a tracheoesophageal fistula. To prevent air from entering the stomach, once the syringe barrel is attached to the gastrostomy tube, the nurse should 1. Unclamp the tube after pouring the complete amount of formula to be administered into the syringe barrel. 2. Pour all the formula to be administered into the syringe barrel after opening the clamp. 3. Maintain a continuous flow of formula down the side of the syringe barrel. Once the clamp is opened, allow a small amount of formula to enter the stomach before pouring more formula into the syringe barrel. The correct answer is 1. The best way to prevent air from entering the stomach when feeding an infant through a gastrostomy tube is to open the clamp after all the formula has been placed in the syringe barrel. Doing so prevents air from mixing with the formula and thus being introduced into the stomach. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanursguy.com.